Oh no, my sheep, she's broken. Hello, my name is Taylor Holton, and I am 13 years old.
And my name is Cheyenne Bragg, and I'm also 13 years old.
And we are a part of Southern Stars 4-H Club.
There's a situation in the barn. Let's go. Here we have a sick lamb, tag number 1092. She has symptoms of not eating or drinking enough daily. Her behavior is abnormal as she is normally very active but rests more often.
Assuring the health of an animal is a primary responsibility of owning animals. You can tell if an animal is acting differently by creating a bond with them and knowing their personality. Disease affects health, but health can also be affected by non-infectious causes.
Diseases can be caused by infection agents such as bacteria, viruses, fungi, protozoa, parasites, etc. Non-infectious health problems can be caused by malnutrition, injury, cancer, genetic defects, environmental hazards, etc.
So now we know a little about what kinds of sicknesses there are and what they are caused by. We can start to treat the sickened lamb. To do this, we start with the basics of checking the temperature, heart rate, and respiration rate.
To measure the temperature of your lamb, use a thermometer shown here. The temperature of your lamb should range from 100.9 to 103.8 degrees Fahrenheit.
The heart rate of a lamb should range from 60 to 90 beats per minute and is measured by placing your fingertips between their ribs just behind the elbow. Hold your fingers there steadily for a minute while counting the beats.
The breaths per minute of a sheep and lamb are different. The sheep's respiration rate ranges from 12 to 15 breaths per minute, and a lamb's respiration rate ranges from 20 to 25 breaths per minute.
To check the respiration rate, you count the expansion and relaxation of the rib cage and abdominal wall. If any of these are abnormal, calling a vet would be the best option. Now that we have figured out what and how to figure out what illness the lamb has, we need to treat it. Medications have a purpose, ingredients, and instruction section on the bottle or box explaining what the medication is used for, how much to give, and how to give it.
There are many different ways to administer medication, including orally, which is done through the mouth, intramuscular, which is done through the muscle, intermammary, which is done through the mammary tissue, topical, which is a medical paste that is applied through the outside of the body, subcutaneous, which is done under the skin, intravenous, which is done in the vein, and intrauterine, which is done through the uterus.
The two most frequently used types of injections are subcutaneous and intramuscular. Every form of administering medications has its downfalls, but be careful when using topical treatments because they can be dangerous toward humans if touched with bare hands, and medications given by injection because you can inject yourself with medication unsafe for humans. Oral medications can be administered by feed, a drench, or a balling gun.
Having to go through all these steps takes more than what we're making it seem like. In this order, such as quarantining, giving correct medication dosage and duration of medications, and providing fresh, clean water and fresh food with safety from the weather.
To quarantine is to separate a particular animal from its herd if you see symptoms and to be watched carefully. When administering medications, identify the medication and check the bottle or box to make sure you have the right medication for the job and dosage for the animal. Duration of medication is how long between each dosage you administer the medication.
Providing clean water, fresh food, and a safe spot for your animals, you are assuring that they are not getting hurt in the weather and get sick from not being properly taken care of. A safe spot should include proper fencing, a clean area, and nothing that could harm them, such as machines.
Keeping your animals away from harm and healthy is not the only important factor of proper animal care. Records should be kept on every animal. Records include the shots that were given, the dosage of the shots, when the shots were given, weight of the animal, date the weight was taken, and intake of feed and water. Okay.
Overall, we learned that animals are not only for the fun of it, feeding, watering, and working. There are a lot more to owning animals. Owning animals comes with record keeping of health-related things that are taking place, as well as recognizing illnesses, administering medications, vaccines, and preventing illnesses.
Animals take time, effort, and dedication.
Thank you for listening.